Obviously, for those who follow our social media, we've been very outspoken about extraction, retraction orthodontics and the use of extractions and orthodontic treatments. I want to make it clear that we're not blaming orthodontists for all the problems that our patients show up with in the office. They come in with small mouths. They come in with a situation where there's not enough room for their teeth and for their tongue. Clearly, the orthodontists have not caused the conditions where these kids didn't grow to be the proper size and shape. And there's a lot of pressures placed upon a treatment situation. People are coming into the office and they want their teeth straight, they want it done quickly. Sometimes there's financial concern. And I do believe most orthodontists are acting with the patient's best interest in mind. Orthodontists are highly trained, skilled people when it comes to treating bite in orthodontic situations. There's no part of an orthodontic curriculum where they specifically teach all the ins and outs of like airway situations. That is just not part of their training. That was never part of my training. I actually have an anesthesia license, and that is part of an anesthesia training where all they'll do is sit there all day, talk about how the tongue needs to be positioned up and out of the throat, how air should go in the nose. That creates an airway dynamic situation, and how at nighttime when people go to sleep, which is what happens when they become anesthetized, that's when the airway is going to be at its worst. No part of that is an orthodontics training. What I really want to do is just try to do better for our patients, and our practice every day is a new opportunity to better our practices. And I would like for our patients to take a look at all the treatments anytime you go in for a medical procedure. Do a little bit of research, look into how those treatments are going to impact everything. Be educated, participate with our providers in making the best decision for yourself. Sometimes orthodontic treatments can be quite complex. When you have patients who need expansion, sometimes they have asymmetries, sometimes they need complex movements of teeth in and around their mouth to correct midline discrepancies. These things are going to take a lot of time. They're going to take a lot of patience. Sometimes they can be more expensive to do the right way. I just think we all need to work together and have a higher understanding, our patients as well as us, and do the treatments that are best for our patients. I'd like to bring awareness to the community that extraction, retraction, orthodontics really should never be done. And that's all we're really trying to do, is educate the public and bring awareness, try to improve our practice and our profession, try to do treatments for our patients better than now and better than later.